Hai, Assalamualaikum and Selamat Sejahtera to Doctor. I'm Shree here and you can call me Shree. Today I'm going to talk about urinary system. Okay, the function of the urinary system, it is not simple as making urine and then get rid of it. When that is the primary function, it is the removal of metabolic waste, that really what urine contains. And then solid waste, of course, would be in the fecal matter, which is the part of the digestive system in the terms of getting rid of it. But here is all about filtering blood and then getting rid of metabolic waste out of your bodily fluids. In addition to that, you have the regulation of blood volume and blood pressure. Your kidneys actually secrete hormone in response to how much blood is flowing through them. The pressure, either lack of fluid or too much fluid, and that has an effect on your blood pressure and blood volume. It also regulates the plasma concentration of various electrolytes, various minerals like sodium, potassium, chloride, etc. because it's going to get rid of more of those or less of those through urine depending on how much you have. And it also helps to stabilize blood pH in addition to getting rid of stuffs like sodium or hanging on to it and hanging on to getting rid of those hydrogen ion. That has an effect on pH in addition bicarbonate ions, which has an alkaline level. So if you know enough about pH, hanging on to this would actually make the blood slightly more acidic. Getting rid of this actually make the blood slightly more basic, and normal pH for the blood and human body is 7.4 on the pH scale. That's slightly basic. It also conserves valuable nutrition. You have to hang on certain things in your bloodstream and not getting rid of them. That comes down to kidney function. So we look at all the different organs and tissue. The urinary system, there are four main players. Here is a little drawing over here. You have got the kidneys, of course. They look like kidney. This is the left kidney and this is the right kidney, and the left kidney ever so slightly higher than the right kidney, a little bit lower because the liver kind of hanging down over it. So it's normal with two kidneys. There are the ureters, which of these tubes that takes recently made urine out of the kidneys to a temporary storage spot known as urinary bladder. Just calling it the bladder is not sufficient in anatomy because there is also a gallbladder. So you want to specify that is the urinary bladder, and then the urethra. The urethra, it is the tube that finally takes urine out of the body, and it is of course longer in males, shorter in females, and I'll discuss that later. Okay, so when we look at kidneys, these amazing organs actually make urine. You do have two kidney on the either side of the spine between the spine and the thoracic vertebrae at the bottom of the thoracic curvature. So number 12, where your last ribs are found, and down to about your third lumbar vertebra, which means that they are only partially covered by your rib cage. Just the top portion has some ribs hopping on just posterior to it. And your kidneys actually are very much a posterior organ. There is a term kidney shot if someone hits you right back. They're right under the rib cage, and that kind of impact could definitely damage kidneys. That happens in contact spots often, but the left kidney is slightly superior to the higher to right one. They are held placed by surrounding connective tissue, and that surrounding connective tissues include the peritoneum, and it's a nice wrapping around your abdominal organs that keeps them in a place, and there are other neighboring organs that help. Of course, the reddish brown, of course, because of the high blood flow. There is a lot of blood going on to your kidney every second of the day. There's about 10 cm long and 5.5 cm wide and 3 cm thick, with a mass of 150 grams each. So here are the major parts. Let's label this. The renal cortex, you see that right here as the adrenal glands or any other organ that has the term cortex, that the superficial outer part of it. So the renal cortex, you're going to see a lot of going on in the next few slides in terms of how the filtration process gets the renal medulla or medulla. Some people pronounce it at the way a bit deeper, just like with the adrenal medulla. So you can see that these little areas kind of look like a triangular, that really where most of the module is going on, and those are renal pyramids because they do look like a pyramidal triangle. So here's the renal pyramid. Those make up most of the medullary layer in the kidneys, and this is the cross section of the frontal section or coronal section through a kidney from this is the cross section of frontal section of coronal section through a kidney from the outside would not see. They each calyces calyx major and minor. So once you have the development of urine, it comes off the medullary area into what are called minor calyxes lead to major calyxes. Here then it goes into what's called the renal pelvis. Is the collecting area in right here, and this is the other term, helium, the exit region of the kidney, which is the renal pelvis empties into ureters. Okay, now the glomerulus, the little bunch of capillaries, and they go into capsule like water and ions, etc., moving across the capsular space tube. The Bowman capsule, named after Dr. Bowman, and it lead into PCT, which is the twisty turny proximal to then later it will be distal, more distant proximal convoluted tubule or PCT, and it leads to loop of Henle. There are actually two parts, which is a descending limb of the loop and an ascending limb of the loop. DCT is little more distant. And then how does the stuff get filtered out of glomerulus? Bunch of capillaries, and they are fenestrated. Instead of solute microscopic particles going through the barriers of the capillaries wall, and they just don't go through a little border of cell. There actually needs cell little holes essentially, and the fenestrated capillaries make it easy to quickly pass through. Blood pressure forces water and small solutes across the membrane and into capsular space. The Bowman's capsule here, and some important nutrients like glucose, fatty acids, fatty amino acids, and vitamins can also pass through it. And then after leave the glomerulus, the mixture of these water solute and organic compounds. Here we are in proximal convoluted tubule. It is the first segment of this renal tubule and line up with simple cuboidal epithelium with microvilli. And then next is DCT, which is distal convoluted tubule, which differs from PCT because it is small diameter than PCT and lack of microvilli, where you find some microvilli associated with cuboidal epithelial. So it is important to actively secrete ion, acids, drugs, toxins, and your kidney actually helping out with the getting rid of drugs and toxin. The liver, of course, play a big part, and the kidney gonna help this. Selectively, it absorbs sodium, calcium ions based on your needs, depending on your calcium and sodium level in your blood, and that's gonna determine how selective it is. And then the final filtration happens here at the collecting system, where the concentrated urine pass through the collecting duct, which merge into papillary duct, and this will get different all the collection from different nephron regions and empty to and leading to the minor calyx, and it will lead to major calyxes. It is kind of the hallways and lead the urine to renal pelvis and finally out into the ureters. And then the summary of the urine formation. You need to know three basic process that you really need to remember. First is the filtration. That's mainly what's going on with the glomerulus, that collection of capillaries and Bowman's capsule. So blood pressure forces water and some other solutes into Bowman's capsule to start it off. So the initial filtration from out of your blood, then reabsorption. Then the reabsorption is getting through stuff that you want to hang on to out of the tube, so it doesn't escape through your urine. So water and solute are removed from the tube, the PCT and etc., and go into peritubular fluid. Outside of those important fluids and nutrients are reabsorbed into blood to active transport and osmosis. As blood leaves the kidney, and that stuff is not going to escape through your urine, and secretion solutes are transported from the peritubular fluid. Okay, now you'll have that final chance to get stuff that you do not want to get rid out of the peritubular fluid, where stuff has been reabsorbed and it can go back into distal part of the tube. Okay, the peritubular fluid where stuff has been reabsorbed and it can go back into distal part of the tube. You'll then into the collecting system. This is when necessary to do, because filtration alone is not enough to get unwanted waste out of the plasma. So if we didn't have the secretory ability, the amount of wastes to get rid of every time we urinate would not be sufficient to maintain osmosis. So urine is about 95% water, sometimes 93.7, sometimes 97, and this is the average most of the time. But what's the other 5-ish%? What else in it? Here are some main players that are going to be found in urine. Firstly is urea. It's very abundant in terms of how concentrated in the urine versus the other things. It comes from the breakdown of amino acid that are happening constantly in your body, and it's a way to get that waste out. And amino acids, remember, the building blocks of protein, or a lot of protein stuff going on in the terms of decomposition of the protein in your body, and you need to remake the proteins. They don't last forever. And then creatinine comes from the breakdown of creatinine phosphate, which is the muscles, and creatinine phosphate can aid with remaking ATP quickly in muscles, which is important uric acid from the cycling of the nitrogenous bases of RNA in your cells, which is constantly throughout your life. So uric acid, it's gonna be from this RNA base. And what makes the urine yellow next is it's urobilin. In a term, some people also refer to urochrome. Literally means color of the urine. So urobilin is a product of breakdown of bilirubin, and that also influences the color of fecal matter. But the reason why the urine is yellow when bilirubin on broken down, and this comes from the breakdown of red blood cell from heme groups in RBCs, and that by itself is yellowish. So makes up enough of urine to give it that yellow color. Sometimes urine is a bit more clear and typically means specific concentration of water is just much higher. So if your water is clear, means that you're super hydrated and you have so much water relative to other times that you're getting rid of that water. You have taken in so much of water, so you don't need that much of, or if your urine is clear, it could be mean you're drunk because your ADH, antidiuretic hormone, that the ability to hang on to the water in the kidneys is definitely damaged by alcohol intoxication. And the amazing thing about urine is, even though some people will find it disgusting, there is nothing actually harmful about in terms of bacteria, because it is sterile. I mean, unless you have UTI, but you're self-sterile when it's come out of your body. There is no bacteria in it. You may have seen survival show, a list of things people do, and then if you're stranded on a land in the middle of the ocean on a desert where there is no water or no moisture, or if you want to prolong life, one of these things, you can drink this urine, because it's a way to get those fluid back in your body that you have let go eventually. If you just keep doing that, you're going to stop making urine, because you're not introducing any new water in your body. Even though that's disgusting to think about, it can keep you alive for a little longer. But if you urinate into, let's say, a bottle, and you wanna set a while, and let's say if you don't drink it right away, you just wait few hours and hours in the bottle, and you just urinated in, there was a bacteria, and your urine is warm as nutritions bacteria. You're going to start eating stuff in there and dividing. So if you do leave urine in the container, that can introduce a bacterial infection into your body. But you're itself sterile. The ureters that what actually taking urine down into urinary bladder. It's a pair of muscular tubes here that connects kidney to the urinary bladder, firmly attached to the posterior wall. Remember, the kidneys are found in the back portion of your abdominal region, so the tubes are coming out of it are going to be there are 3 tissue layers, similar to what we saw with the digestive system. The stuff like inner mucosa, that's actually adjacent to the lumen. That's where urine going to be a muscular layer, because you do have to help move along, and the outer connective tissue that's going to help keep these tubes anchored to the neighboring tissues and organs. Peristalsis, we have seen the term before, moving your digestive stuffs through through the fallopian tube, ova, eggs, waiting for sperm. Peristalsis, thus wave like a muscular contraction actually happens here. It sweeps down, it sweeps urine down through this tube. It's not just gravity taking them down, but sweeping the muscular action of peristalsis actually gets the urine constantly into a bladder. Your urinary bladder, a hollow muscular organ that is a temporary reservoir of the urine. Of course, it can hold as much as 1 liter of urine. So think about one of those soda bottles, and it's 2 liter. That also a lot of urine when you really gonna have you go, because just as much as 200 milliliters of urine, the 20% of that it is going to initiate some urinary reflexes that are going to start preparing your body for the urinary time. When we look inside of the urinary bladder, you're going to see folds similar what you see inside of the stomach. So these little folds as the urinary bladder expands as a more urine, those routes are less obvious because of the stretching mechanism of the bladder, the trigone, which is the triangular feeding area that the urine is going to be collected into and then eventually emptied into the urethra. The border through the between trigone and the urethra is the internal urethral sphincter. Is always a muscular kind of doorway from one part of tubular passageway to another, and in this case is involuntary. You do not have voluntary muscle control over this. Is going to open up as stretching happens in the inferior parts of the urinary bladder, so that you need to urinate as the internal urethral sphincter relaxes and lets more urine out of. That's when you need to go. So the urethra is the final tube leading out of the urinary bladder, and then out of some body it extends from the neck of the urinary bladder and finally exit out longer in males than in females. You can see the image here where you can take into account the external genitalia of the man. The urethra can sometimes be 8 inches long because you're also including the internal part prior to it entering to the penis, and that empties out of the bladder. So taking into your account, the P is the length in the man urinary tract is going to be longer in female, and it's only about that big because once you come out of the bladder you're going to hit the external genitalia of the females. So like UTI likelihood, your inner tract infection likelihood is actually much more common in females. And the external urethral sphincter, it is what the final muscular doorway that's not letting the urine out of you. Have the voluntary control over the similar to the external anal sphincter. So voluntary control, you can hold to the point. Once your bladder has been filled up, that 1 liter max and the urine is creeping into the urethra and then need to let go is going to happen. And the microturation is what we call the technical term. It is the technical term for urinating, and the microturation reflex that's going to happen as you get stretching the bladder. As your neuron connects to the bladder, gets sense of stretching, and it's going to send signal to the brain and then send a signal back down to the voluntary muscles where you actually actively urinate. But remember, there is an involuntary part as well. As the involuntary muscle relaxes, need to actually finally let it go going to happen. So urinary condition like I mentioned a bit ago, UTI, urine tract infection, much more common in women because it's a typically bacterial infection. And if you think about the urinary tract of female just being big, the easy for bacteria or ability to take over the region happens much easier, so the dividing bacteria can quickly invade to that tube, and this is long, and it is less likely that the bacteria are going to able to conquer that tube because the significant UTI, it does happen in men, don't get me wrong, but it's just more common in women, And then next is kidney stones. Kidney stones happen in men and women. I've heard that they happen slightly more in men. I don't know if the dietary differences on average, but kidney stones can happen a variety of reasons. It's basically a collection of hard deposits in a part of kidney over time, and they are so hard, large, and relative to the size of the tubules, kidney that they cannot get out completely through the urethra, and they do get back up. As you can see the image here, actually these are the fragments of kidney stone, very tiny. You can see that most are, they are half millimeter in diameter, so very tiny. If you think how these tiny things, the tubules are leading, how these tiny things can stuck, and then how these tiny the tubules are leading urine out of the body, and how they get stuck. Of course, you're going to get back up. They're very painful. One amazing that you can get rid of them. That doesn't require a surgery. And then they have learned, if you project sound waves at kidney, you can sometimes shatter these kidney stones into tinier bits that can be naturally eliminated from the body, which is amazing to think about. So technical term is kidney stone is renal calculi or the renal calculus, and the renal calculus would be the kidney dialysis, which is accompanied by the renal failure. So if somebody's kidneys are not getting the job done to filtering their blood, and you will hook them up to a machine, basically filters their blood for them. And then since the kidney also a lot of to do with the stimulating making of the red blood cells, either cells in the bone marrow drugs that help you make red blood cell, also be introduced into a body action, into a body in addition to the filtering of their blood, and this is a temporary solution. Kidney dialysis does not cure kidney failure, but it prolongs life. But the need for kidney transplant you can get from a transplant from a donor who is deceased. And I have heard that 85% effective on average if you get a kidney from a relative whose life likelihood success, and prolonging your life is more like 90% something in terms of adding the years on your life and it being a successful transplants. And then those kidney cells is not close enough to fool your body into thinking of it's our cells, so you have to actually would have take the immune suppressing drugs to kind of calm down your immune system responses to that tissue introduction, and that makes a person who receive a kidney transplant slightly more successful to the other illness. But it is worth it, prolonging your life, like glomerulonephritis. So nephritis basically means like infection affecting not within the kidney, but infection affecting the nephrons, and it has to do with the glomerulus coming into the region. So the amazing thing about this infection is like the infection not in the kidney itself, but some infection is in the body now affecting the kidney negatively. And the reason why the negative impact happen is with certain infections in the body, you're gonna get buildup of a lot of different antibodies in response to the antigen, that parts of your lymphatic system's ability to beat up the illness. But the buildup can actually, when it gets into glomerulus, that can really affect your blood flow out of the glomerular into those corpuscles and into Bowman's capsule specifically. So this is an infection that is negatively impacted on the filtration ability of the kidney, and then here comes the incontinence, is the inability to fully control when you're going to urinate. And this tend to happen more in older people as they age. The musculature in the terms of like keeping urine inside is not as good also, Strokes and like Alzheimer's can have impact on the ability to control the urination, and it also can happen in pregnant women to the baby, pregnant woman, because the baby is going to like take off a lot of space in the region of the abdomen, so it can not only press the bladder but also stretch, like stretch out some those urethral muscles, making it harder to hang on urine during pregnancy for some women. So thank you for watching and listening to me. This is me, Shree, signing off from Shree, and thank you so much.